Hi everyone, I think I make it start time. For me it's 11 a.m. I'm not quite sure what the time is for you, but I think we're all in sync. Adam, can you tell me from what you can see with people on the webinar whether we're good to go?
Yeah, so we have a few guests so far, so we can begin starting and then as people trickle in.
Okay, well, just while we wait for a few others to join us on this call, can I welcome you and thank you for being here. My name's Rose Kendall. I'm the clinical advisor for Jobskin in Australia, and also co-hosting the call is Veronica Eichmann, who's the clinical advisor in New Zealand. And I think, Veronica, it's probably 4 p.m. your time, is that right? Oh, she's disappeared. And then, and also, yes, and then also Adam Ho, who is the Managing Director for Jobskin. So as I say, we're delighted that you've joined us. Thank you for taking the time. I think it's unlikely that we're going to fill the full hour. This webinar is a little bit shorter than the previous one, but we did want to allow plenty of time for questions at the end, as the sort of patients who you would be considering the Lymphcrop Vest for are often quite complex. Now, just a couple of logistical things. We're really happy for this to be interactive. So if you do have a question as we go, if it's something that's not, you know, highly specific to the content we're covering right at that point, just jot a note down and we'll cover it in the Q&A questions at the end. You can type in a question and Veronica's picking those up, and if there's a time that's particularly suitable for that to be answered, she'll interject and raise your question or invite you to raise the question. Or you can unmute your mic and just sort of say, oh, quick question. But can we ask that you keep your mic off for the duration, just because any background noise is shared with everybody and it can become quite distracting. And the last thing I think to include in sort of our housekeeping at the start is that this webinar and the one that's going to immediately follow this one, we, as you're probably aware, we're running it in 2 different time slots to try and make it a bit easier to access. Each of these are being recorded and they will be available to you. They'll be sent to you as a link, and they're available to you to re-watch and re-listen. You'll also receive a PD certificate if you've registered to be on the webinar. If any of your colleagues sort of watch it later, we're not in a position to provide PD certificates for that, but we certainly want to provide one for you for being here. So I think we've probably allowed a few minutes just to get people that are just struggling to get here. So I think we will get started. Adam, is there anything else that we need to cover?
I think just a quick comment around the patient photos as well.
Oh, yes. Yes. Thank you, Adam. Thanks for that reminder. We do have some patient photos, including these 2 that you see on the front screen here. We are extremely grateful to patients who very graciously allowed us to use their images and their medical history. So we would very much appreciate it if you don't screenshot those slides, you don't take that you don't share those images in any way, shape or form. Thanks, Adam. All right, let's get started. Ooh, now we have a problem that my slide won't advance. Excuse me just a sec, I've got a bit of a tech issue here and I'm going to have to see if I can... There we go. All right, it's got that sorted. All right, so what we're going to cover today is what exactly is the Lymphcrop Vest and why did it come about? We're going to talk a bit about the features and benefits of this particular garment. Then it's important that you understand what the standard design is and sort of the range of variations, because because there are standard variations, I suppose you could say, in the design, there's a lot of measuring that you don't have to do unless you want to vary from what's the standard. We're going to go through measuring for the Lymphcrop vest through a training video that will be up on the Jobskin website very soon. Bear with us today because it's not quite right. We're still doing some editing on it. Unfortunately, we had a couple of details that were out of frame, so we're doing a little bit of toing and froing, and we're also missing an image in there of the male version of the Lymphcrop vest, but by the time it hits the website, that will all be there, so you can watch that anytime. We're going to talk about adding an arm sleeve if you have somebody who has upper limb lymphedema. And then we've got 3 case studies, 2 female case studies and a male case study, which really does highlight some of the options and modifications. And then we will just run through the actual process of prescription and ordering so that you don't feel overwhelmed when you look at the form. All right, so let's start with what exactly is the Lymphcrop vest. It's a custom-made compression garment that's made out of a power net, and it's reinforced with a fabric called CDA. CDA is generally not available for a whole garment, but it's soft and smooth, and it's quite strong, so it's ideal for the reinforcement panels over the breast and for the chest wall. It is a custom-made garment. It's not a variation on a half-made. They are made from scratch exactly to suit your patient and your patient's preference. And we designed this garment because we were aware that clinicians were often struggling with finding something suitable for people with breast or chest wall edema that ticked basically all the boxes that needed to be included. So we designed it because it is customizable. So it can, tall, short, thin, fat, large breasts, evenly sized breasts, different sized breasts, all of that can be taken into account. And I think one of the real strengths of the Lymphcrop vest is its ability to accommodate the asymmetry of breast size. What we identified and the sort of feedback that we got from clinicians who were using ready-to-wear garments, which, make no mistake, there is still a very strong place for ready-to-wear garments, but they just don't suit everybody. But the limitations that we identified or were fed back to us was that there was insufficient compression on the chest wall. And I could probably expand that a little bit further to say that oftentimes where there was a compressive panel on the chest wall, it didn't come high enough into the axilla, so it caused a band rather than true compression on the chest wall. Breast cups, the bra cups were always the same size. Oftentimes, while the shoulder straps in quite a lot of the ready-to-wear garments are wider than a what we could call a normal bra, they still were not wide enough for some people. There's the limitations of size, of course, with a ready-to-wear garment. Some people complained about comfort, and actually quite recently I've had a few people complaining about the heat in a ready-to-wear garment. And for the most part, a lot of the ready-to-wear garments are not suitable for men, and are often sold through outlets that seem to be more female-friendly than male. So before we kind of get into the garment itself, I thought we'd talk a little bit about the options for dealing with breast asymmetry. And from our perspective, what we would say is that there are 4 alternatives if you have one breast larger than the other, or also, in the case of men, breast tissue that is expanded on one side and not on the other. So you can either, in the case of women wearing a bra, you can either pad the bra cup on the smaller side to bring the smaller breast up to the size of the larger breast, or you can squeeze the larger breast into a smaller cup, which is, from a clinical point of view, is far from ideal, as we all know. Or you could go for a boob tube type option, maybe with straps, which basically compresses the enlarged breast, sort of squeezes everything flatter, and it allows it to spill across the midline. That does mean quite well dispersed compression, but cosmetically, it's a little bit more like wearing a flattened sports bra, and particularly when men or women want to wear lower neck garments, the cleavage for women, or just the spilling of the tissue for men over to the other side, is cosmetically not very pleasing. Or the fourth alternative is to provide different sized bra cups within the one garment. Now, you can imagine that to do that in a ready-to-wear would just be the most hideously large sizing range, which I'm sure for producers of ready-to-wear garments is not really viable. And that's really where we thought this was something that we could assist with in the for clinical needs. So let's go back and look at exactly what the Lymphcrop Vest looks like. This is a fairly, well, this is the standard design for Lymphcrop Vest. So the front neckline is level with the sternal component. So what we call the sternal component is that vertical panel that comes up through the middle, where the zip is in the center of, and the neckline comes down to the top of that. And if you look at a lot of like standard bras, they have this kind of construction, and so that's where our neckline sits. There is a lined front zip, so there's a soft satin lining that sits behind that zip so that it's comfortable and it won't pinch the skin when you do it up. And those of you who work using custom cut and sew garments will know that oftentimes a zip, particularly for a torso garment, has got like a flap that folds over the top that covers the zip. We've chosen to remove that for this garment because it looks a little bit more medical, you could say, or a little bit more like a assistive garment, whereas we were really trying to make this as cosmetically acceptable as possible. The back neckline, as standard, has a 12 centimetre drop. You can definitely drop it lower than that, but and usually these are cosmetic preferences that govern that. But be mindful, if you drop the neckline too low, you will lose compression around the chest wall, because if it drops below the level of the axilla, I would say, because we really rely on the compression circumferentially in order to compress the chest wall. Purely for a cosmetic point of view, it comes standard with coordinating lace over the bra cups. Your patient can choose a contrast colour if they prefer, or they can choose not to have lace if they just want something that's possibly a little bit more no nonsense, and they can choose contrasting colours so that it looks a little bit more like activewear, but we'll come back to that in a little while. And then standard is anterior and side compression lining, which goes high up into the axilla so that we've got good therapeutic compression over the chest wall. And there's a couple of images a little further on where you can see exactly what the inside of the garment looks like. And finally, it comes with 5 centimetre silicone-backed elastic, which to help anchorage. Now, if your patient doesn't want the silicone-backed elastic, that can be substituted with just normal elastic. And if you particularly want it narrower than 5 centimetres, that can be done. We do, for the most part, suggest 5 centimetres because that seems to work well for anchorage. Now, the inside, as I said, we've got some images, and I apologise that they're quite faint, but we realise that that's kind of one of the catches when you've got a pale pink vest. So in the left-hand image, you can see the silicone-backed elastic that goes around the base of the garment. You can also see that satin lining over the zip. But the beige on the inside, that is the CDA fabric, and that is the compressive lining. And in this case, it's on both bra cups and both chest walls. And if you have a look at the right-hand image, you can see how that CDA compression lining comes round to the two back seams. But because this is a customizable garment, if you need something different, more or less than that, then that can easily be accommodated. And now the masculine version. You can see on the left-hand image here that you can have it with sleeves or in or sleeveless. So essentially it's the same garment but without the bra cup construction. And you can see on the right-hand image that the CDA is over the chest wall there with a silicone-backed elastic at the bottom. And in the left-hand image, you can see that that lining comes round to those back seams. Now, in terms of like therapeutic options, what can you do to vary this based on your patient's needs? Routinely comes as a sleeveless garment. That's the standard as we saw previously. But if you need, if you have a patient who also has upper limb edema, rather than wear an arm sleeve and then a short sleeved or sleeveless vest, I should say, and then risk the pocket of edema that would develop between the top of the arm sleeve and the shoulder strap of the vest, you can have the arm sleeve built in. And we will discuss that a little bit further, but I will just flag at this point that if you do need an arm sleeve, whether it's short or long, on one side, you do as a minimum need to have a short arm sleeve on the other, because otherwise the garment will pull towards the side of the sleeve and it will be uncomfortable to wear and it won't anchor well. So it doesn't have to be long and long. If you've got one long sleeve, a short will suffice. There also is a possibility to relocate some of the seaming to avoid interruption of lymphatic flow if you are particularly concerned for the clinical needs for your patient. Functional options. Well, one is the prosthesis pouch. Please do forgive us that we have photographed this on an obviously male torso, but all mannequins come with two breasts, so it's very hard to actually depict the absence of a breast. So this particular garment has been made with paired size bra cups, but stitched on the inside there is a pocket, much the same as you would see in ready-to-wear, some of the ready-to-wear lymphedema bras, but there is a prosthesis pouch on the inside. And I did flag a little bit earlier about the difference in cosmetic options. There is a vast range of that patient can choose. As I mentioned, the lace comes standard. It can be a contact hand image, or the right hand image, it's been restyled to have the appearance more of active wear. So that's also an option that you will find on the form. Now, we're just going to start the video for how to measure for the Lymphcrop Vest. As I said earlier, this is the video that it's not quite in its final production stage, so it's still perfectly functional. But we will do this. We had some problems with sound on the second webinar for our previous webinar on the compression for the upper limb. So if that happens, I can't tell from here. So can you please just unmute your mic and let me know, and I've got the script for the video, so I will just speak over it or speak to it if we need to do that. All right? Oops, Now we're going to have problems. Just might have a little bit of trouble getting this started. Oh, there we go. Oh dear. Excuse me. I will see if we can just get this sorted. There we go.
I don't think there's... Oh, okay, yeah.
No sound?
Not at this stage, I don't think, no.
Okay, there should be sound, so I'm just going to take it back to the beginning. I don't know why this is... I'll just have to... I'll take it back to the beginning and I will attempt to sort of talk it through. Okay. If the Lymphcrop Vest is your intro to Jobskin, you'll find it helpful to watch the introduction to the Jobskin measuring video, which outlines the basic principles of measuring and the tools you need. This will make what we cover in this video a little more familiar. One of the real pluses of the Lymphcrop Vest is the fact that asymmetry, including marked asymmetry, can be accommodated. This can be asymmetry of breast size, breast height, or shoulder position, and even in the level of compression. Furthermore, this garment can be modified for men who require compression following a diagnosis of breast cancer or melanoma. If you're going to be incorporating arm sleeves, it's best to take the upper limb measurement first, as you'll need to mark the height of the top tape on each arm with a body marker pencil. You will need 2 purple paper tapes for this, and you'll need to watch the measuring the upper limb video for instructions for how to do it. Please note that if you need an arm sleeve for upper limb lymphedema integrated into the vest, a short or long arm sleeve is required on the unaffected side. This improves stability, fit, anchorage, and comfort. Sleeveless is only available bilaterally. All of the measurements are taken with the Jobskin retractable tape measure, and the Jobskin body marker pencil is also required. A helpful rule of thumb, if you're unsure, is to mark all of the circumferential measurements on the back at the time they're taken. They will not all, in fact, be used as markers for the length measurements, but this is easier than missing markings until you're familiar with the form requirements. The patient should be measured in standing and with breasts or pecs supported, either with an existing bra or with a tubular bandage. For the purpose of this video, our patient has vertical markings on the tubular bandage. This is just so the centre front along the sternal line and the centre back are clear as you watch this video. The neck circumference is taken at the mid-length of the neck. No marking is required. Note this doesn't indicate the height of the garment, rather it's an indication of body proportion for the design of the garment, and so it remains an essential measurement. The shoulder circumferences are taken individually of the left, then right shoulder, as I'll demonstrate. Ask the patient to put their hand on their hip and loop the tape measure under the axilla and up to the coracoid process. Allow the tape to ease as the patient is instructed to let their hand hang down. Record this final measurement. To take the chest measurement, ask the patient to put both hands on their hips and pass the tape measure across the back and under the arms at axillary level. Instruct the patient to hang their hands by their sides and record this eased measurement. Given the potential asymmetry with breast or chest wall lymphedema, you then need to provide left and right semi-circumferential measurements so that the circumference can be apportioned correctly. You then need to take a series of similar circumferential and semi-circumferential measurements at set points down the torso, at the level of the nipples, below the breast, and the end of the support. unless there is a specific need for the garment to be extended, the end of the garment is 5 centimetres below the below breast measurement. All of these levels need to be marked. Linear measurements are then taken for these measurements and are taken at the back, allowing the tape measure to hang free from C7 to the nipple line, just under breast, and to the end of the support. 2 additional measures are taken across the back. Imagine that a plumb line is hanging from the centre of each axilla. Measure from one plumb line to the other across the back of the axilla and across the back at the end of the garment. These are the side seam measurements. If your patient is heavier abdominally, you'll notice the plumb line sits proportionately further back. This is why we use a plumb line measure rather than the midpoint. The side seam needs. The shoulder width measurement is taken on one side only, unless there's a very marked difference, from the base of the neck to the acromion. For the standard sleeveless Lymphcrop, a modified version of this measurement is required, specifying the width of the garment on the shoulder. For vests with sleeves, a measurement is required from the base of the neck over the acromion to the marking of the top arm tape on each arm. This enables the 2 measurement sets, the paper tapes and of the arm and the torso measurements, to meld together. The final measurement required for male or female is under breast to end of garment. For women, perform a bra cup size if possible. If not, please supply bra cup size for the unaffected breast based on previously well-fitting bras. All measurements should be recorded on the form as they are taken. And for this garment, be aware that the standard specs include front neckline to the level of the sternal component, back neckline with a 12 centimetre drop, lined front zip opening, no tab, 5 centimetre silicone back elastic, lace over the bra cups, anterior and side compression lining. However, any of these specs can be altered based on your patient's needs and preferences. Guidelines for how to complete the forms to place an order are explained in the introductory video. Thank you for your patience with that. I hope that didn't sound too distracted. I could hear the script running and was reading from another sheet. So thank you for bearing with me for that. Now, for those of you who haven't used Jobskin before, and if you're needing to integrate a arm sleeve into your garment, we're just going to briefly go through how you read the tape measures. When you, if you watch the video for the Jobskin measuring system, you'll get a sense of how it all works, but sometimes this is the point of confusion. So what you're looking at in front of you on the screen is a Jobskin arm tape that has been obviously secured around a patient's arm, and then the tape's just cut, hence the angled cuts at the top. And sort of what you need to do now here is just decipher what measurement you actually need to provide to the designers so that they can make the garment. So basically this line along here is the measuring point. So it's not at the curved, the arched border or anywhere else, just right along the straight line. And you need to measure in how I describe as a downwards direction. Follow the numbers. I know that sounds incredibly obvious, but it's a little bit, it's easy to be distracted by the solid colour of the spine tape and see the number below the straight line and then count up, but you must always count down from the number before. So if we look at this close up, on this tape here, the measure, well, actually on this tape here, the measurement would be 25.6, or we don't write the decimal points on the form, we just write 256, because each of those little lines is worth 2 millimeters. So 256 for that one. And for this one, it would be, if you try and work it out with me, it would be 247 because it's in between two lines. Okay, now let's move on to the case studies. We've got, as I said, we've got 3 case studies. And this lady is a 58-year-old woman who lives alone. She was diagnosed with left-sided breast cancer in September 2018, and she underwent a lumpectomy and removal of 5 lymph nodes. She had radiation for 7 weeks, but no chemotherapy. And prior to this, she wore a 16 minimized, so she was quite large-breasted beforehand. She developed blisters on the medial aspect of her left breast during radiotherapy, and then 3 months later, the blisters returned, and there was the orange peel texture evident on her breast, and the inferior breast became edematous and firm, and there was edema over the chest wall. I was asked to go and assist a therapist with measuring her, and when I saw her, she was wearing a ready-to-wear lymphedema bra, and she had grooves, what I described as grooves in her shoulder. These grooves were 3 centimetres wide and 1 centimetre deep, sort of the bra cutting into her breast tissue, and the skin was excoriated. This was purely due to the weight of her breasts pulling down on her shoulders. So, and the therapist had prescribed a Lymphcrop Vest, so I went and assisted with that measure. So now this is the version of the Lymphcrop Vest that the therapist and I and the patient chose together. She asked for a rear closing bra, and she asked for all those bra hooks, which seems incredibly difficult to put on. Like it's not something I would have chosen myself. I would have opted for something at the front, but she felt that that gave her really stable support. She did subsequently get a second bra, which she had chose the same again. She just changed the colour, and she's got quite a nifty way of putting it on, where she keeps the top probably half dozen hooks done up, and she undoes the bottom one so that she can physically don it, and then she does the bra hooks up. She also requested a lower axilla, because where her chest wall edema was sitting was actually along the inferior breast, the level of the inferior breast. So she found that more comfortable. She wanted a low neckline for cosmetic reasons, and she was provided with additional reinforcement over the left bra cup because of how firm the edema was. And the other thing I should say is that we opted for 5 centimetre wide shoulder straps, as you can see. Now, case study 2 is a 54-year-old woman, also lives alone. She was diagnosed with melanoma, and at conclusion of chemotherapy and radiotherapy, she noted swelling on her left breast. She started manual lymphatic drainage. She had laser therapy. She used intermittent compression. She had lymphatic taping, and she wore a torso-sized tubigrip at night with Mobiderm inserts, as well as using ready-to-wear bras. But she just couldn't find something that fit her well, given the marked difference in her breast. So again, the therapist prescribed the Lymphcrop Vest. And this particular lady chose what is essentially the standard Lymphcrop Vest, but without the lace over the bra cups. So you can see that the neckline is to the level of the sternal strap. She's got the front zip. She's got a 12 centimetre drop at the back. And one thing I would note there is that it's not easy to see, but it was her left breast, as I've said, that was the one that was edematous. And you can, if you look closely, you can see that the left breast is actually significantly larger, sits fractionally lower because of the size of the breast, but also spills a little bit past the midline. And this was really a choice on the patient's part, because she really wanted her breasts to look as symmetrical as possible. So she was happy with the support and compression that she was getting over the breasts, even though it pushed the cleavage a little bit to the right. Now, our final case study, and I do apologise that I don't have a photograph of this particular patient, but I do have a photograph of the garment style that was made for him. He was a 76-year-old man, or is a 76-year-old man, who lives with his wife, and he's a semi-retired farmer. He's a big bloke, big, strong bloke, now lives on a 5-hectare block and is very active and busy outside, still doing a lot of physical work. He was diagnosed with a malignant melanoma over the left lat dorsi, which was excised in January of 2017. And then he subsequently underwent an axillary node dissection almost 2 years later, actually. But there were no signs of metastatic disease on a later PET scan. In January of last year, he developed pockets of swelling under the left chest wall, and the left breast tissue became really quite pendulous. So he was carrying a bit of extra weight, so his right pec was a little bit more fleshy, but his left breast was really pec was really starting to become quite breast-like and quite distressing for him. He did get some temporary relief from wearing a tuber grip, like the torso-sized tuber grip, but that was only going to be a short-term solution. So he was prescribed a Lymphcrop Vest, which his garment actually, because his swelling extended right up into the axilla, his garment was styled similarly to the one that you can see there, except that his arm sleeves were actually elbow length, so that he had adequate compression over the upper arm. He had no swelling or lymphedema in his affected arm, and so that enabled him to continue to be active, but address the issue of the edema. So just a quick refresher, and I've realised that with video we've now got covering this 3 times, but standard options, the neckline is standard to the sternal component. There's a lined front zip without a tab. The back neckline is 12-centimetre drop. Lace over the bra cups for a female Lymphcrop vest. The anterior and side compression lining, and the 5-centimetre silicone backed elastic. But as you've seen, we can change the way that the garment is donned and doffed. We can change the heights of the garment. We can change where the lining is to meet your client's clinical needs and their personal preferences. So in summary, the variations are the neckline height, front and back, the length of the garment. I haven't really addressed this completely, but for some people particularly if they've got big tummies, they're actually better off having a something that's more vest-like and less crop-like, so that it extends down over their belly and either anchors on their waist, or if it's sort of upper torso, extra fleshy tissue, or under the abdomen if that's required. So the elastic to anchor can be silicone backed or normal. The shoulder strap width can vary. Arm sleeves can be added or removed. The lining area can be altered. There's a range of fastening options in terms of placement. You can add a prosthesis pouch. We can also include satin lining for comfort, which is particularly helpful for radiation, fibrosis, scarring or sensitivity. And of course, there's a range of cosmetic options. So to prescribe an order, we have a specific Lymphcrop Vest form, and it just walks you down the page with the measurements exactly as they are in the video. So we're basically starting at the neck and working down the form. It does highlight both on the front and the back of the form what those standard variations are, but there's a substantial comment section so that you can vary that entirely as you choose. And then as for all Jobskin garments, it needs to be accompanied with the order form, which is like the cover form that has got a patient, a therapist and delivery details. Now, that takes us pretty much through our the main part of our presentation, and we'd be really happy to open this up for questions now, and particularly if you've got patients in mind that you're not sure whether this would suit or not, we'd be really happy to discuss that without their identifying details, of course. Over to you, Veronica.
Sorry, Rose, can you maybe just tell us a little bit about what might you do to prevent the silicon-backed elastic at the bottom from rolling up?
Oh, that's a great question, because I think for somebody who is isn't carrying a little extra weight, or is the measurement at the under breast is fairly similar to the measurement 5 centimeters lower around the end of the garment, the rolling up is usually not a problem. But if it is a problem, a couple of things I would recommend. One is going for a narrower band of silicon-backed elastic, or the other is also making sure that the end of garment measurement is not too tight, because if it's too tight, it will obviously want to roll to the circumference that is a little bit narrower. If I'm thinking of a bit of a portly tummy, so the end of garment measurement is bigger than the under breast, and so it's going to want to roll up or bunch up. So in which case I would make sure that end of garment measurement is not too tight. Can you think of anything else, Veronica, that you've done with these?
No, not specifically.
No. Yeah.
Probably another really good question, Rose, is when you're going through the order form measuring the patient, on the order form it gives you the option to measure the left and right breast separately. Would you do that with a bra on, bra off? Would you do that with prosthesis in place or not?
Yeah. Generally, the more that you can simulate the size, the shape that you want the height, probably it's better to express it, the height and position that the breasts are going to sit in, the more that you can simulate that, the better the measurement you're going to get. So I would normally say measure with a bra on, and if they can't fit their existing bra, a poor fitting bra is actually adequate to position, or for you to be able to get the circumferential measurements. But if the poor fitting bra is actually not providing adequate support for the breasts, then I would actually, particularly if you've got a helper, I would get the helper to hoik the straps up above the shoulder. I'm not sure if you can see me, but just kind of lift it up so that you are then lifting the breasts and then measure and mark at that point in time. The other way to do it is like our volunteer patient who was wearing Tubigrip. So Tubigrip is into the position depending on the size.
Oh, thank you.
All right. If we don't have any other questions, thank you for being here. And just be aware that we have got a great design team, and somehow that slide seems to have dropped off my presentation, I think. We've got a great design team at the factory in Nunawading, and they're available to help you with any technical questions. If you're thinking, I really want to try and accommodate this in the garment, they're only too happy to work with you on that. But if you've got clinical queries, or if you need face-to-face clinical support within COVID restrictions, of course, sometimes that face-to-face actually means via Zoom or FaceTime, then Veronica and I are only too happy to help you. I was actually just with a therapist this morning helping them measure a Lymphcrop Vest because it's the first time that they've done that. So we're very happy to help you in any way that we can. As I said at the beginning, you will have a link sent to you, so you're welcome to re-watch this, and also the training, or the sort of the measuring video, will be up on the Jobskin website, we hope by no later than the end of next week. So if you're going to give it a crack, then it's probably a good idea just to re-watch that and refresh that before you do so. All right, thanks for joining us. Our webinar next month is, I've got this popping up, you can probably see that. Our webinar next month is the 9th of December. It's slightly different time slots because, again, we're wanting to allow plenty of questions, but it's an overview of garment prescription and design. So if you're an experienced therapist, it might give you a few ways that you can tweak what you're doing, or may give you good principles and language when you're working with therapists that you're training. And for new therapists, it's a very comprehensive overview. So 9th of December, we'd love to see you there. All right, bye then.